excited that you're going to be able to hear from him today. So let's give a warm welcome to Mr. Phillip Blair.
Awesome. Thank you, Ben. Can everybody hear me all right? All right. Well, I want to start by giving a round of applause to Self Fund. This is one of the best conferences I've had a chance to partake in the past, and it's been already a hit this year. So thank you, Self Fund Health. Let's give them another round of applause for putting this on. All right. So I'm going to start by a show of hands. Who is all an employer in this room? It is amazing to see that many employers in this room, because I'm going to be a little biased here. I think employers are the most important people in this room if we really want to affect change. And that is not to undercut any of the phenomenal partners that we have in here today, whether it's the brokers, the point solutions, the Self Fund Health, the PBMs, the DPCs, all of them are phenomenal. But if you are an employer and you are not a part of actively trying to make a change, nothing is going to change. And so I'm going to hit on that a little bit today as I go through this presentation. The first part of this presentation is going to talk about the journey that Gamber-Johnson has taken. It's been a 5-year journey, and I'm going to go relatively quickly through that portion of the presentation so I can focus on what's important today, and that's how we've been able to work with our employees to drive utilization and really start to get them to embrace what being a self-funded employer is all about. And so as I go through the first part of this presentation, you're probably going to see some of the similar things that you've heard in the past. You're going to see very similar ideology to what Self-Fund Health brings. And so as I go through this, don't mind me as I click through relatively quickly through these. But to start with, a little bit more about who Gamber-Johnson is. We're a global manufacturer headquartered in Stevens Point, Wisconsin. If you're really familiar with our products, you either work in public safety or you've spent way too much time in the back of a police vehicle, because we make the equipment that keeps you in the back of the police vehicle. So hopefully it's the former if you know who we are, or hopefully you don't know us at all, because we work very heavily in the public safety market. We do have a number of portfolio companies under our umbrella. We have about 455 worldwide employees. We have 400 US-based employees. We have 204 employees on our medical plan and 395 total lives. You might ask yourself, why is there a big difference? We recently acquired a company out of Florida that will be joining our medical plan as of January 1, and we'll be deploying this same strategy there as they integrate within our health plan. All right, so these are the steps that Gamber-Johnson has taken over the last 5 years to get to where we are today. One of the things I would like to say, as employers in this room, I know many of you are really far along this journey, and some of you might not be as far down this journey. Just know this is a 5-year journey. There's a lot of trials, tribulations. There's things that I would tell you that this is what we did at Gamber-Johnson, and I would say definitely don't do that. And there's things that have worked really, really well. And so just know this isn't something that happens overnight, and it's important to be a part of the journey. We've heard that from multiple speakers today, that you have to be willing to keep at this to be successful at the end of the day. All right. So first and foremost, Gamber-Johnson is self-funded. I'm going to go on a limb here and say most of the groups in here are probably self-funded. If you're currently fully insured, the first step in your journey is to get out of the fully insured world and into some level of self-funding, whether that's fully self-funded through the captive model like Gamber-Johnson, level funded. There's multiple options. I would encourage you, the only option that you can't continue to do is be fully insured, because there's essentially no way you can win, or there is no way you can win in the fully insured world. And so Gamber is self-insured through a captive model. It's been a big benefit to us. There's pros and cons of being in a captive, but essentially we pool all of our employees and the lives of other employers into a pool to purchase stop loss. And you can see a bit of a breakdown of what that looks like from a fully insured to a captive model. Well, essentially within our captive, what we're attempting to do is make sure that we push out to the farthest extent possible when we have to actually purchase that true insurance or that stop loss. And we take on a joint risk in that captive layer as an employer. All right. Gamber-Johnson, like many other employers in this room, does have a 3-tiered health plan. So tier 1 is our bread and butter. This is what we call the Team Gamber-Johnson network. This starts first and foremost with our DPCs. To date, we actually have 5 different DPC partners, because we have locations not only in Wisconsin, but we have locations in Cincinnati, Brea, California, Perry, Florida, Madison, Wisconsin, and Minnetonka, Minnesota. And we actually have a clinic partner in every single one of those locations that we've been able to establish. So we have been able to scale that DPC arrangement, which has been a common problem I know for a lot of employers. So I'm happy to talk about that offline if anybody has to talk about. So tier 1 providers. For our employees, they know that a tier 1 provider or somebody in the Team Gamber-Johnson network is going to be no cost or low cost to them if you utilize them for that service. And in a lot of situations, they may even be incentivized, whether it's through reimbursement for gas mileage or an actual payroll bonus for utilizing our tier 1 providers. Tier 2 is our regular in-network. So in the state of Wisconsin, our in-network group is managed by the Alliance. And then tier 3 is our regular out-of-network. So a secret sauce for a lot of us is that tier 1 is continually building out that group of preferred providers that our employees can go to, from everything from mental health to all the way to the surgical care and everything in between. All right. So next is a big part of our strategy, and I talked about it within that tier 1, is partnering with an independent DPC. You'll see that independent is in big, bold letters, and it's because it's very important that that DPC is independent. Within all of our DPC partners, we partner with them first and foremost to make sure that our employees have quick and easy access to get the primary care that they need. And the big thing that we've seen as the key to our success is when we get our employees into the DPC and they use their DPC as their primary care provider, we have the ability to have that DPC take the quarterback seat, to use a sports reference like everybody else has today. And when they take that quarterback seat, when those higher dollar procedures come down the pipe, we have the ability to steer those to our Team GJ providers. And without that relationship, we have not been able to see that much success. And I'll talk a little bit more about that here in an upcoming slide, but using your DPC as the quarterback for referrals is a key part of our strategy, making sure not only do we take care of everything on the primary care side, but when those high dollar procedures come down, whether it's a total knee, a spinal surgery, their primary care provider is making the first referral into our preferred provider group and not into the hospital system. So we started with DPC, and then we started to build out our network of primary care providers. So I think we opened Gamber-Johnson on-site clinic about 4 years ago, and we started with just DPC. We had primary care, and then one of the things that we quickly realized is, hey, this is a really great benefit. Our employees are really bought into this. But when we start talking about, okay, what other care do we need to cover that the primary care group can't, we were sending them back into the hospital system. So we ultimately weren't controlling all the expenses we could. So through a series of fortunate events, we developed our very first direct contract, which today is literally not even a contract. It's just a handshake agreement with a local PT group that's in our industrial park. He stopped by one day, dropped off some cookies for us. I said, we'd love to send our employees directly to you for PT services if you can give us an agreeable rate. To this day, they are our #1 PT group. And again, they bill us on a per member or per visit basis. It's a very great rate. And we don't even have a contract in place. And it's been a 4-year relationship. I don't necessarily recommend not having a contract in place, but he prefers not to. He's a great guy and he's independent. Outside of that, we started to take a look at, okay, we've been able to tackle primary care. We've been able to tackle PT. What's next? And some of the low-hanging fruit that we saw was imaging. So we looked out there. There's a lot of really great independent imaging providers, 2 of them which are sponsors here today that we partner with at Gamber-Johnson. We said, okay, we would love to pay you directly for your services and steer our employees to you so that we can get MRIs, CTs, ultrasounds at a more affordable rate and keep those out of the hospital system. Okay, so now we got primary care, we got imaging, we got PT. Then we just kept going down that list. Today, we're in a continuous build mode for the Team GJ network and our list of tier 1 providers. Just yesterday, I had an employee come to me and they said, hey, I'd really love it if you could find somebody in the dermatology space. We don't necessarily have a local provider within Stevens Point that is in our tier 1 space in the dermatology, but our network has been built by those exact suggestions from our employees, so we go out and find those. So how do we select the Team GJ network providers? We always look for quality first and foremost. We can't jeopardize that for the sake of cost. I would be the first one. I will not be the first one to tell you this, but when it comes to healthcare, the dynamic where cost equals quality is not the truth. In a lot of situations, I can tell you it's actually the opposite. The lower cost provider tends to have the more quality in healthcare, which is not something you would see in the normal consumer market. Then accessibility. We got to make sure that our employees can get in to see the preferred providers. If our employees have to wait 6 months to get in, it doesn't really help us at the end of the day make sure that our employees get the care that they need. Affordability, making sure that they are in line with what we consider a tier 1 provider, which is typically anybody under 200% of Medicare. Transparency, being able to provide us the full billing information and bundled pricing. Accountability, and then maintaining accountability to these standards. Let's see, do you want to make sure I didn't miss anything on that? And so on the right-hand side or your left-hand side up there, you'll see your DPC, again, being that critical piece to this entire thing. If you do not have a primary care partner who is sitting in that quarterback chair, you're going to have many more challenges in making sure that when your employees need specialized care, that it stays out of the hospital system and goes to your preferred providers. All right, so next I'm going to talk about the main topic today is what we have done at Gamber-Johnson to foster employee engagement and dependent engagement. So the major question I'm going to help each one of you answer today is, okay, I understand the strategy. You've seen it before, install DPC, move self-funded. How do you get that engagement for your employees and their dependents to make sure that they are also being good stewards and utilizing your preferred network? And I'm going to talk about some of the things that have been successful for us. So senior leadership needs to be actively involved. So this is a really big key. So each one of you today probably partners or will be partnering with some of the great partners that are in this room today. And that is a good first step. But if you think the only step that you have to take as an employer is find the right partners, you're going to have a tough road ahead of you, because senior leadership and your HR team and everybody included needs to be a part of this journey and actively working on it. So each one of you as employers, whether you like it or not, we're all health insurance companies. And we need to make sure that we dedicate the necessary time as employers that we would to any other business expense that we have. You know, as a manufacturer, when we purchase metal, I can tell you that we do not over-purchase metal by 30% at the end of the year, because we are taking a close look at that and making sure that we're getting the correct market rate for the steel that we buy. But as employers, we don't ask those same questions when it comes to healthcare. And it's important that as employers, we are actively involved in those discussions. If it's just your broker and your partners and you're not there, you're not going to be able to get the utilization and engagement that you want to at the end of the day. So I encourage you, if you think that taking this journey is something you want to go through, be ready to be an active participant and an active voice in making sure that this strategy is voiced to your team members. And it starts at the top. If you don't have buy-in from senior leadership, I would say that that is the first step, and a full stop. If you don't have that buy-in from senior leadership, you have to get that before you go anywhere else. And then the other thing is, I always like to point out, because I get this question a lot, is, okay, health is personal. And when it comes to being involved in someone's health, it can be a difficult thing to do, especially when you're putting on your HR hat. You're like, I don't necessarily want to have to talk to the employee, nor maybe does that employee really want to have to talk to me about what they have going on in their health journey. But it's important for a successful strategy, in my opinion, that every employer designate a HIPAA officer, and that HIPAA officer be comfortable in making sure that they can be an advocate for their employees within your strategy. If you are not going to have somebody take the quarterback seat at the employer level and partner with your DPC, you're going to struggle to make sure that you get that engagement that you want to see at the DPC level. So designate a HIPAA officer. You don't have to necessarily pry and get involved in your employees' health, but be there and make sure that you're vocal in that if your employees or their dependents need support, that you're going to be there to make sure that they have that support, and you can help navigate that journey along with your healthcare providers. And then along with senior leadership is always making sure that you follow and lead by example. When we started down this journey, it was actually interesting. Both the president of Gamber-Johnson and myself, our spouses worked in the school districts. And we had the opportunity to technically take a premium-free plan through the local school district. Myself and the president both actively made a choice that said, if we're going to expect our employees to utilize this medical plan and go down this journey, that we better do the same thing too. So we actually kept our families on our plan, forego the premium-free plan, to make sure that we, as leaders within the organization, are not only managing the plan, but being willing to use the plan that we're putting together on our own. And I can tell you, our plan is far better than what I've heard and experienced from some of the other groups. And so it's been a really great opportunity, not only for me and my family on the health journey, but it was something that made sure that our employees knew that we're going to be along with this. And if it's going to be good enough for them, it better be good enough for us. All right, so build trust culture through transparency. So one of the things that we did when we set out to start on our healthcare journey was we wanted to make sure we clearly explained the reasons behind the strategy, choice, and partners. And so it starts with answering the fundamental questions. So we sat in front of our employees and said, okay, we're making a change. We're opening an on-site clinic, and we're a self-funded employer. What does it mean to be a self-funded employer? So we explain at a high level to our employees that means when they and their families go to the doctor, at the end of the day, Gamber-Johnson is the one that is paying for that bill up to a certain amount. So you set the foundation and the understanding of why you're doing the things that you're doing. And then we also talk about how an employee's independence healthcare decisions affect the premium that they pay. You know, and it's not meant to call out employees' independence for using the wrong primary care provider, but it's meant to educate them in that they need to understand, and their families understand, that if they really want to see that premium stay low out of their paycheck, they're going to have to be a part of that journey with us. And we're going to partner and make sure that we can do that, but we need their support and aid in doing that. So that means, okay, I might have to switch my primary care provider to the DPC. And we talk about if we don't have those actions, what that looks like. And we give scenarios to our employees. Again, not in the means of making them feel bad about their choices, but so they actually understand how premium is calculated at the end of the day and how that directly affects what they pay out of their paycheck. And I can tell you, in a lot of situations, in almost every situation, it's eye-opening for a lot of employees because they may not fully understand how that whole system works. And when you explain it to them, they start to feel a little bit more empowerment and that their decisions can affect that at the end of the day. And then the big thing for us is, like, as a self-funded employer, we said if we go down this journey, our goal is to make sure that we stop increasing the cost that we're charging you for your health plan. We want to make sure your health plan stays affordable, and we want to make it a richer health plan at the end of the day. And so we dedicated to our employees that the savings that we generate through this strategy stay with the employees. And that's been a really big hit for us. So it's been able to fund things like we have an annual Netflix and Hulu membership that we fund with our savings dollars. We've been able to basically hold premiums flat for the last 4 years in a row. We have a first-time homebuyer program that is funded by the savings dollars from this. And we're very vocal in saying that these savings and these benefits are directly related to the actions that the employees take. All right, and then address employees' concern directly. So I remember specifically standing on a stage when we launched our on-site clinic, and an employee said, "Why would I use your on-site clinic?" They raised their hand. I'm standing in front of the stage. We were like, "Why would you use our on-site clinic? You're just going to get access to all of our health information, and that's what you want it for." And so we tackle those challenges head on. We dismiss those claims. We don't want access to your health information. We're doing it because of X, Y, Z, and making sure that we're fully transparent with everything that we're doing, and so that we can. And if there is that cynic in the room, we call it out before that cynical base can grow. The other thing is your partners must be cheap. They must be low quality. One of the things that we've really pushed on is having our partners demonstrate that that is not the case. And so when our employees use our preferred providers and they have good interactions, we make sure that they go out and tell other employees about those good interactions. And we let our partners do the talking in that sense. And we can quickly dispel that myth that just because we have a preferred provider for this orthopedic surgery doesn't mean they're any less quality than a local hospital. In fact, we will guarantee that we'll get you in faster to that surgeon, and they'll do it same day, or they'll do it much quicker and a better outcome than the hospital would be able to do in most situations. And then the other one is, why should I help the company save money? We all have those employees. Everybody's had those, I would guess. I see a lot of heads shaking out there that, why would I want to help the employee save money? And that's where I try to bring it back to help yourself save money. If you don't help us make these changes, the frustrations that you all have with the healthcare and the state of healthcare is today are going to continue. We're wanting to partner with you as our employee base to make these changes And if you don't partner with us, I can tell you, I can predict the future, because what you're seeing now is going to continue to happen 3 years down the road. So having that conversation with employees is really key. And I can tell you that not every employee at Gamber-Johnson loves Phillip Blair. It's not the first thing, but they do appreciate the fact that we're open and honest about the things that we do. And we've built a culture on that transparency. If somebody wants to know how we vetted this partner, why we did this versus why we did that, we will tell them. And I'll talk about healthcare, for 24 hours straight if you want me to. And most of the time, our employees are trying to get out of the room because the open enrollment meeting's actually been 2 hours already. And they're like, okay, enough is enough. We'll use the Team GJ network, Phil. Just please stop talking. All right, so this is a really big key piece for me. We have a fairly complicated medical plan, but the thing that I always tell employees is that you don't have to understand, despite our education efforts and everything that we do, you don't have to understand all the intricacies of what we do. We're going to tell you all the intricacies of what we do from a transparency standpoint, but we need to make sure that that care pathway is as simple as possible for the employees. Because if the care pathway is no better than what the hospital systems can provide, I can tell you you're not going to get the utilization and engagement that you're looking for. And so you can see in that top care pathway, it's going straight from our primary care provider, the referral and care navigation directly to that specialist care. So that care pathway is faster or at least the same as the traditional hospital network. So if our employees are using our independent primary care group, we make sure that it's as simple as possible for them to get not only their primary care, but if they need ancillary care beyond that, it's very, very simple for them to do that. I've seen in a lot of other groups where there has been a bit of a struggle to get the engagement, that the care pathway is just too complex. So, and not to call out any group with the 1-800 number here, but if a lot of groups say, well, I have this care navigation group, and the first stop for the employees is the hospital system. Their primary care doctor is in the hospital. And if the expectation is after that primary care visit, the primary care doctor is like, I think you may need to be referred to an orthopedic specialist. Your expectation is that the employee is going to pick up a phone, call a care navigation person and say, hey, my primary care doctor wants to make a referral. Where should I refer them to? You're going to be sorely mistaken, because the referral's already been made, and the employee 99% of the time is not going to pick up that phone and make that phone call. So you have to make sure that it's as easy as possible for the employees to get the care that they need. And one of the other big things that we have done and how we built out our network of preferred providers is making sure that it's also incredibly easy for the provider at the end of the day. So you might ask yourself, Gamber-Johnson doesn't have that many employees. How do you develop all these direct contracts with these independent groups? Well, we come to the table making sure that we provide value to them as well. We don't prior authorize any groups within Tier 1, so they don't have to fill out any of that paperwork. We make sure that we make payment within 30 days or less, and in some situations, we'll even prepay for services, so we can help with the cash flow issues that many providers have. And so when you're looking to build out your network of direct contracts, don't think you need this size of employee or this massive employees to do it. You just have to take a look at the pain points that providers have today and show how you can fix those. And so we make sure that we have the administrative pathway taken care of for the providers, and we also make sure that that care pathway is as simple as possible for the employees. So eliminate barriers. Consult with employees to identify barriers from utilizing the preferred providers, then actively listen to what those barriers are and try to eliminate them. So one of the things that we did right away when we opened our on-site clinic is that we made it so that any employee that was using our on-site clinic could do so on company time without punching out. Now, if you ask some of our leaders, they don't particularly love that, because we probably have a handful of employees that probably see the clinic once a week, every week, and they might get a little extra time off the floor. But at the end of the day, the value that has driven to making sure that those employees who sit in the camp of, I don't need a primary care doctor, I'm not going to go to the doctor, we've made it so simple and easy and incentivized them to do that they literally do it on company time. We eliminated that barrier. And now we've been able to help employees who haven't had a primary care doctor for the last 10 plus years establish care. And in some situations, we've found issues that we were able to detect and intervene at an early basis. Some other examples. A lot of our partners are not in Stevens Point, Wisconsin. A lot of our partners are actually in Milwaukee. And so how do we get an employee to travel from Stevens Point, Wisconsin to Milwaukee to have a hernia surgery, to have an Achilles repair? Well, we make sure that we eliminate any of those barriers. If it's a financial barrier about mileage, well, we'll reimburse that. I might have to stay in a hotel. Well, we'll reimburse that as well. I don't have enough PTO or unpaid time off. We'll make sure you take care of that. Because at the end of the day, that employee can easily make a decision to go to the hospital and get that care. And we need to make sure if they're helping us make those savings, we make it as simple as possible for them as well. I don't want to change my primary care provider. We hear that a lot. And we're not about disrupting that primary care relationship because it is so crucial, but we start small. Okay, you don't want to change your primary care provider? Totally fine. How about you have our clinic do your lab work so you don't have to pay for that at the end of the day, and we'll send that directly to your primary care provider. Okay, I created a touch point with the clinic, and now that touch point starts to build. And a year, or maybe not less than a year down the road, we've seen it. We're like, well, I'm already just getting my lab work here. How about you just do my visit? And pretty soon we were able to start seeing them switch to our independent primary care because they're seeing the value of that. And again, we've made it very easy for them to see them. Educate your employees. So don't worry, I'm not gonna walk through this slide too well, but we get to a very granular level when it comes to education. It's a part of our pledge for transparency. So these are actually two more simple examples that I give to employees about how costs flow through our medical plan. So we show them how care is navigated and what their costs are at the end of the day. And it's total cost. It's their premium plus what they're paying for those care so that we can help employees make educated decisions about using a tier 1 provider. What medical plan is the best for them? And so we actually have, I'm a big nerd, so I have like 20 of these where I can show employees and walk through like, what does it look like? And the aha moments that we've seen in just showing this information has helped employees choose a different medical plan that might be better for them and understand that, hey, if I use a tier 1 provider and I'm on the family high deductible health plan, I can save $5,000. Yes, you can save $5,000 because we make sure that we reimburse all of those costs, and you're going to be eligible for a bonus to offset any costs that you may have on the high deductible health plan. As another example on the family side that we share. And you can see that in these examples, one of the big things that we show is, and the circle's got a little miscued, is tier 2, which would be your local hospital systems in this example, $45,000 for the care for this total knee surgery versus tier 1, $20,000. So we show that delta to our employees and say, this is what's driving our ability to give you no-cost care through tier 1 because there's that big of a delta. And you're wondering, oh, and you're going to give me a $2,000 bonus in this example? Yes, because we saved $20,000 as an organization, and we want to make sure we give your fair share back to you. What about the other What about the other $20,000? Well, we use that to fund all those benefit programs I talked about and to keep premiums low. Because at the end of the day, it's all about controlling the controllable, and we have high-cost claimants. There's things that we can't control. We have an employee that needs care at Freighter, and we don't need to steer them away from Freighter because they need top-notch care at Freighter. Those things are going to happen, and so we talk about controlling the controllable. And then also motivate your employees to be part of the solution. I've hit on this a few times, but everybody, the vast majority of people, not everybody, is very dissatisfied with the healthcare as it is today and use that as a fuel. You know, I've stood in front of employees and says, who has a primary care doctor? Who loves healthcare? Who loves getting surprise bills? And I talk about all those things and say, this is what we're doing to eliminate all those concerns for you at the employee level. And that has really been a benefit for us to kind of use that dissatisfaction as a fuel to ultimately make their change. Share personal stories about challenges we all face with the current state of healthcare. Is one of the big things that we do is we show a lot of examples of wins at Gamber-Johnson, de-identified from a HIPAA standpoint, but when we have wins, we share those success stories, and then we make sure that the early adopters and the use of our team and our preferred providers, we use them as peer advocates. Because I can stand on the stage and tell everybody till I'm blue in the face that the Team Gamber-Johnson Network, our DPC, our surgical partners are the best. You only trust me so much at the end of the day, but if I'm standing next to the employee that's helping me build a docking station for one of those police squads, I trust that employee, that peer right next to me a lot more than I trust the person standing on the stage during open enrollment meetings. And we use them as advocates to push and encourage employees to use that. Communicate cost savings directly to employees. We tell them what we're saving. You know, we don't hide that number. We use those savings to benefit employees. I've talked about that. Here's a couple example stories. You can see this is one directly through Solstice Health. We had actually, this was a dependent who needed a complex orthopedic surgery. We were able to get them into Solstice 1 week faster than we were at the hospital, and they actually downgraded the needed surgery to a lower level and instead of paying $50,000, which is a pretty conservative estimate, we paid $16,000. And we actually got the surgical list from Solstice for this surgery, and it showed exactly what screws were used and that level of transparency. If you're looking to get into a business, surgical screws are incredibly expensive. There must be a huge margin because they're like $400 a piece. Next one is another on the prescription side. This is an international sourcing success story. We were paying $20,000 per script, and we were able to get that $6,000 per script. In this situation, the moment that employee filled the medication, the first of the year, they were hitting their out-of-pocket, or not their out-of-pocket, they were hitting their deductible. We waive all cost share in this situation, and the employee got it for free because, again, we're saving $13,000 every time we source that medication. Drive utilization, incentivize, reward, and thank employees. Waive deductible and copay, I've talked about that. Integrate and wellness and programs into preferred providers. There's different thoughts on wellness programs. The one way we use our wellness program is to make sure we increase touch points with our clinics. And so if you get an annual physical and you have a provider sign off that you're up to date with your annual age and gender specific screenings through our clinic, you get a $100 payroll bonus. So we make sure that there's a touch point with those clinics. Continually market your strategy and partners, not just during open enrollment. Our employees get emails and blasts, and I talk about all this stuff during company meetings all the time so it stays relevant. Drive continuous improvement, create open feedback. We also want to make sure that we don't necessarily want to listen to the loudest voice, but if there's a consistent voice saying something isn't working, be willing to hit the pause button, take a step back and figure it out so that that particular issue doesn't derail what you're trying to do. So you have to be willing to listen and pause during your initiative. And then drive ongoing improvement based on feedback and make sure your employees know that that feedback resulted in a change. Continue improvement. So I'm going to jump to the results. So this is just this year on some of the surgical steerage that we've had. You can see that we've allowed what we paid versus the average allowed based on our the claims book that we subscribe to. We saved $93,000 for these procedures this year alone. This is our average per employee per year cost trend on a monthly basis from when we started our journey to where we are today. You can see there's still a lot of ebbs and flows in that. You know, we control the controllable, we can't control everything, and it is a journey. This is information in regards to a case study we did with Innovia and our Net Promoter Score that kind of highlights that our DPC is working. I always like to say the favorite employee of Gamber-Johnson is definitely not me. It's actually our on-site nurse who is not actually an employee of Gamber-Johnson. She's an employee of Innovia Health. And this is the I Love Gamber-Johnson slide. All the awards and recognition, and these all go to a credit to our employees who've been a big part of what we've been doing.
Boom. Thank you. It's not often I can say this, but maybe somebody that has more energy than I do, Mr.
You gotta
Phillip.
talk fast. I should have a lot of slides. I should have cut that down.
That's fantastic. So we'll get into some Q&A. Get your Slido app out. Ask the questions. Thumbs up to the questions that you like. And I just want to reiterate something before we get into the Q&A in that when you run a conference, obviously, Self-Fund Health is a for-profit company, right? And we want to work and do business with other companies, but we're not a fit for everybody. And there are a lot of companies doing things that we are doing. And so we just want to make it very clear that no matter where you're at in your journey, whether you're doing it yourself, you're working with an advisor to do these certain things, you're working with other TPA partners, that sort of thing, we love that you're here and we want you to continue to be here. And Phillip is a great example of somebody that has, I wouldn't say figured it out yourself, because obviously you've had a ton of work, but somebody that's put the energy and the resource into figuring it out for your staff, for your company, and have reaped the rewards of that. And so that is very admirable, and it's something that we cheer on. Even though we're not really doing business together per se, we are still very excited that he is doing this in Wisconsin, because this all pushes the movement forward all together. And I'm going to butcher this, but a rising tide floats all boats. Is that? All right. Somebody nodded, so we'll go with it. All right, let's get to the Q&A. Okay. Have you tried to I really like this question. Have you tried to partner with any actual health systems, health level systems? You talk about independent providers. What about some health systems?
I got to share a quick story, literally from a call yesterday. So yes, I have attempted to, and some of the conversations have bared more fruit than others. I've gotten close with some of the hospital systems, and I do think there is an opportunity if you have the right people in that hospital system that want to be a part of the change. But I've also been a part of a number of conversations that start under the guise of let's partner, and then you quickly realize that they're not going anywhere. I'll share a quick anecdotal story. I will not name the hospital system, but we have a surgery upcoming for one of our employees. I was able to negotiate a direct agreement with the surgeon, who is absolutely phenomenal, actually performed surgery for my wife, very affordable rate and top-notch surgeon. I was able to negotiate a direct contract for the anesthesiology, about $1,000 for the case, so very, very good rate. Went to the hospital system where the surgery is being performed. By a series of unfortunate events, it was scheduled in the hospital, and it's an outpatient procedure. And I was talking to the CFO of this hospital. I happened to get their number somehow. I'm very persistent, so I was able to get the CFO's number. For a month, I was going back and forth and said, give me a reasonable rate. The first rate they threw out there was $16,000. We needed 2 hours of OR time for $16,000. I said, that's more than we paid for the same exact procedure all in total last time. That's not going to work. And they said, okay, I'll come back. They came back and said, well, $16,000 is the absolute best we can do. We can't go below Medicare rates. And I said, you think the $16,000 is the Medicare rate for this procedure? And the conversation quickly fizzled out from there. So I can tell you that it's not always working, but if you find the right people, I've had some pretty positive conversations with hospitals. Not all hospitals.
That's amazing. And I will say, Phillip, you said it at the beginning about employers, right? What drives change more than anything else is consumerism. If we can shop for healthcare the same way we shop for everything else, I would argue we might not be in the problem we're necessarily in. You know, if you go to Target, Walmart, Amazon, Best Buy, the price of the big screen TVs is going to be about the same, right? Why is that? Because you see the price when you walk into the store. So
fun fact, I know the allowable amount's actually going to be $12,000, so they're $4,000 over what I knew they were going to get paid through insurance anyway.
The discount.
Yeah, and I offered to prepay at $8,000 to $10,000, like before the employee even walked in, and that didn't get him enough to bite. And I was like, well, that's an interesting decision, and now they'll wait 6 months to get reimbursed by insurance. Yeah.
That's awesome. Okay, we'll hit through a couple of these questions. So, okay, self-fund health's not for everybody, and we're not working with self-fund health with Gamber-Johnson. What TPA are you using?
We use Prairie State today. It's been a great...
Wisconsin-based company?
Yep. Independent. They have been a great partner. The access and level to information, actually taking over our direct contracts and managing them for us has really allowed us to scale our operations. I have a lot of great partners in contact, whether it's self-fund or other groups that I know in the state of Wisconsin. But as we've continued to scale and grow Gamber-Johnson as a whole, most of our growth has been outside the state of Wisconsin. So we needed a partner like Prairie State's where I could develop a contract and then pass it off and let them manage it. And they've been really great in aiding us to do that. And the key is they're independent.
Absolutely. Okay, this is, I'm going to merge this into two. Okay, so you're doing a lot of the work yourself. Mr. Phillip, you doing a lot of the work, the steerage, the navigation. One, do you even have a broker?
Yes.
And two, do you have any other HR team built out to help you with this push?
Yes, so we do have a broker, and there's a lot of effort put in partnership with our broker and our other teams. So I want to make it very clear that this is not Phillip is the one-person show on all of this. I have a lot of partners to do this. I absolutely have a passion, but I could not have done this with a lot of the partners that we have today. I do have other members of my team. I do focus from just an organizational standpoint. I oversee all of HR, but I lead most of the benefits side of things. But though my partners in HR help me with some of the things outside of the benefits side, and they do help me on the benefits side a little bit. They manage a lot of the recruiting, different things like that, so I can focus my attention. Because when I talk to my senior leadership team, I say I think one of the biggest impact I can have from an HR professional standpoint is healthcare, where I can actually see an ROI for the efforts. Not that other HR things do not have ROIs, they do, but I can quantify what these efforts mean. At the end of the day, I'm helping our employees access good care and quality care. That's the biggest use of my time, and I'm actually a healthcare nerd, so I do it in my free time too. So yeah.
So you actually like this?
It's a love-hate relationship.
I mean, it's fine. I'm just making sure we're all...
I despise the state of where we were, and I wanted to figure out a way to make it better for our employees.
I don't know if I should ask this question compliance reasons, but HSA.
Actually, I'm happy to answer the question.
Do you offer an HSA?
We do.
With your zero-tier benefits?
We do.
Okay.
And I'll explain how we manage that. So you're probably specifically talking about first dollar coverage rules and making sure that you do not violate first dollar coverage rules when you have an HSA. And so when we look at our three-tiered plan, and you would have saw it in an example there, is that if an employee, we have the lowest allowable deductible to have an HSA. And so if we have an employee that needs a knee surgery at Solstice, they will pay $1,650 if they're on the single plan, because that is their minimum deductible, subtracted to any medical expenses they had that track towards their deductible. So we make sure that we are in compliance with those rules. On the back side, we have a pretty exhaustive incentive list to say that that knee surgery, based on the average allowable versus what we paid based on our contract, a percentage of that savings goes back to that employee. So in that situation for a knee, for example, they may pay $1,650 if they haven't met anything towards their deductible, but they get a $2,000 taxable bonus for that procedure, making sure that we don't violate the first dollar coverage rules. The bonus is taxable, so there's no issues on that. So yes, we do have, and it is a little bit more of a administrative work for me and my team, but it was our way of making sure that we had a similar enough benefit as possible and remaining compliant to our PPO plan. On our PPO plan, everything's just straight free. On our high deductible health plan, we will charge that minimum deductible. And the way we get around that on the DPC side is not get around it because we're compliant. We've actually ran this through our risk attorney, is we actually have what we call a clinic access fee. And so our employees that are on the high deductible health plan pay a clinic access fee, so they are paying for those services. And so it's not a fee every time they walk in. They pay a very reasonable fee to have access to that, and that fee is ultimately offset by HSA contributions from the organization. That's between everybody in this room. But yes, we are compliant, and there are ways to work around that. It does take a little bit of effort and work through that, but some of the new provisions within the Big Beautiful Bill will hopefully streamline some of that, specifically with DPC. But yes, bonuses, incentives, and then the clinic access fee is how we make sure we are compliant with it.
And what I mean, from the self-fund health plan side, this is one of the places that we're going to respectfully disagree with how Phillip is doing it, not so much even because of compliance and the hurdles and regulations and that sort of thing. It's mostly just simplicity, right? Why go back and reimburse people if you could just make it free to begin with, and they're going to do it anyway in our experience, right? And so that's one of the things that we've gone back and forth with together with Phillip and how he's running it. A lot of other companies are doing the same thing as him. And so, we go for the simplicity of the plan design, of the administration, because we feel like that's going to scale better. But Phillip has obviously managed that himself on his plan, through his partners.
If you're starting brand new, just have a PPO plan. So yeah.
Yeah.
Don't have a high deductible health plan. If you're starting brand new, just go down that route.
A lot more complexity.
Yeah, a lot less complexity if you have a non-HSA eligible plan. But it's something that was really key for us to maintain, specifically when we talked about that benefit to having the HSA, and we've been able to navigate that correctly. And with our partnership with Prairie States, they've taken a lot of that administrative work. I essentially get a report saying what incentives to pay.
Yeah, cool. Okay, let's quick hit some of these in the last 3 minutes that we have. Okay, so do you use the same direct primary care vendor for your clinic in each location? If not, how do you find them and how do you keep them all aligned to the same strategies? I already know this answer because you're scattered all over the United States, but how are you managing that?
So we have different partners in every location, which does sound like a nightmare. But when we go through that process, we actually found most of them through DPC Frontier, which is a website that... www.dpcfrontier.com has a list of the majority of the cash-based direct primary care practices across the country. That's what he's referring to. Exactly. Yep. And so we go and essentially go to RFP, making sure that when we establish a new DPC, they're of like mind and willing to partner at the level of our original clinic, which is Inovia Health, and we build that out with them. On probably biannual basis, we get all of those partners typically on a meeting together just to talk shop as well. So the clinics, while and I don't know if competitors is even the right word because they're not in the same geographical region, so they're not really competitors. But they're all working together and collaborate on there. And then with our TPA partners, our PBM partners too, we make sure that they have the correct contacts with myself and each other to work accordingly as necessary.
I love that. I love that collaboration. That's what we need. Okay, loved the 6 different stages of self-funded journey. Within the 6 stages, any particular challenges? So maybe put differently, what stages were a little bit harder than others? And I'll add one, was just starting the hardest thing in general?
So sometimes just taking, we said leap of faith earlier was something I think a lot of times, especially when you're talking to senior leadership, if you're currently fully insured, and you're like, oh, it's a leap of faith to go self-funded. I don't know if it's going to work. I can tell you that Gamber-Johnson is absolutely not the first company to show that you can be successful. We will not be the last. And that leap of faith may feel like you're jumping off the Grand Canyon, but at this point in time, with all of the support and resources, not only in this room, but in the broader community, you're basically taking a step off a curb at this point in time. It's not that big of a leap of faith. So it could be and does seem like sometimes the biggest hurdle. Outside of that, I think the largest hurdle is just continually evolving that Team GJ network to build that out and establishing those other lists of specialist providers. Just because in a lot of situations, especially as we scale and grow as a company outside the state of Wisconsin, I try to make sure that we have a similar enough benefit across the organization so that if we have a tier 1 provider for orthopedic surgery in Wisconsin, I want to make sure I have one in Florida for our employees there. And so that has been a bit of a challenge, just trying to make sure that we stay on top of that, but we've been able to achieve it.
Awesome. I want to reference something that happened earlier this week. I met with an employer, and I feel like their question really represents what a lot of employers experience when they're taking that leap of faith, right? That Phillip just talked about. And the question was, well, what happens if we switch to your plan and then all of a sudden there's 4 cancers that pop up? What happens now? What happens when your workers' comp has 4 really bad accidents on your workers' comp? What happens to your workers' comp insurance? It goes up like crazy. What happens when your 16-year-old son crashes the car 3 times? It goes up like crazy. There is no magic bullet to this. I think what Phillip is really saying, right, regardless of the partners, regardless of the support and everything, there's no magic bullet, right? Magic pill, silver bullet, that is going to just fix everything in healthcare. It takes a lot of grit and hard work and determination and learning about this and that slow, deliberate process of human behavior change, right? And that's how you manage risk. And I really the whole point of this conference is basically what I just said, and I really want you to go home with.
The one thing I would say to that, would you rather pay for it the year that happened or for the next 10 years if you're fully insured? Because if you pay for it the year that it happened, yes, it's going to be a big hit to you, and you're going to have to navigate that, especially if it's your first year of self-funding. But if you stay fully insured, you're going to pay for it for the next 10 years. It's never